Welcome to my channel. Let's talk. So today let's talk about tattoos versus needles. So my question is, what is it for people who love tattoos and can have a lot of them and it don't bother them? It won't blink an eye. But when it comes to them getting their blood drawn or a shot or an IV put in, it's like the worst imaginable pain. Then they're like, oh no, I'm scared of needles. I don't like needles. And I'm like, okay. But I'm like, you have like a whole two sleeves and a neck tat and some knuckle tats. Like, what? How are you afraid of just one shot or to get your blood drawn when that's just one singular poke? Just one singular poke, and do we gotta do over in less than a minute when tattoos is a bunch of little needles constantly dragging around your skin, sometimes for hours. Like I don't know. It's I can't understand it because I don't have any tattoos because I don't like needles in no way, shape, or form. You can't convince me that the tattoo feel good, and more than you can convince me that I won't feel it if I get a shot. So I'm just trying to see from like the people with the tattoos point of view, like what is it in y'all mindset that's telling y'all that the tattoos is feel good, or some of them y'all be like, oh, it don't even hurt, and then some of them it do hurt, but y'all don't mind because y'all like that type of pain. But when it comes to the getting a shot, it's like, oh no. So like, tell me about that in the comments, because I one time had a guy long time ago when I was um going to phlebotomy school a bunch of years back in, let's see, 2000 and maybe 17 or something. And we had to get our clinical hours, so we got approved to work in the phlebotomy clinics to get our sticks. We got sent to a couple of different places. We got sent to the hospitals and we got sent to the clinics. So, anyways, it was this really good phlebotomy tech that I was with in the hospital one time. The clinics, in a lot of times, is easier to work because, especially like the satellite clinic, because the there's only a lot of times there's only a certain amount of patients that'll get sent for labs, so it kind of be like a cap, so so to say. So if I had to be a phlebotomy tech, I would choose to only work in a clinic. I probably would choose like a private clinic because a lot of times, excuse me, a lot of times if you working in like a hospital system, they rotate you out. They have you work in some of the hospital clinics, not the hospital, but like the clinic sites for the hospital, and um then they'll like, or you sometimes you'll get floated to like the satellites. And there may be a few times where like this clinic really like you and want you, so then like maybe like the doctor or somebody will request that you get sent to this place only, for the days that they need you, which a lot of times they need you every day. Um, and so then probably something can be worked out. But other than that, you get rotated. But anyways, back to my story. So I had to get so many sticks, and so this guy I did a few you know, periodically throughout the day. I think I was doing 8 hours that day, and so I in come this guy, and then and then it be the guys too. It be the guys that be um the most whiniest, I should say, for lack of a better word. Like they do the most more complaining than the women, and they'll come in all big and bulk and muscles and looking all rough and tough and all this stuff, and they rough and tough attire, and no, come in like they Mr. Big Stuff and have tattoos everywhere, and then sit down and then act like they arm gonna fall off if you have to get stick 'em with a needle, even though they knew that what they was coming for, so they knew they had to get stuck. So, anyways, there was this guy. He was Mr. Muscles. He was a nice looking guy, and he had a bunch of different tattoos in different places of his body that was visible. And so you do your verifications, all that, ask all your questions and all that. You look for your vein, find it, and then you proceed. So I'm getting ready to proceed. I got the tourniquet on his arm. I got his arm situated on the little side table. I got the needle in my hand, and I'm about to go for it. Tell me why, as soon as I got the needle close to this man's arm, he started shaking. I it took me so unaware, so like I pulled back because he was like, and I'm like, what's going on? So I'm like, I look up and I see him just a shaking, and so then I pulled the needle away because I was like right here, and finna go. I pulled the needle away. As soon as I pulled the needle away, he stopped, and I'm like, okay. So then, as soon as I get close again, I pull back, put it back in. He starts shaking again. So I stop it completely, and I look up and I ask the man. I said, "Are you okay? You doing all right?" He like, "Yeah, I'm fine. I'm fine." And I'm like, "Are you sure?" He was like, "Yeah." So I'm like, "Okay, one more time." I try and get to this man, get the needle close to his arm. He starts shaking. I'm like, "Okay, look, I need to know what's going on." I said, because you say you fine, but every time I get the needle close to your arm, you start shaking. And I don't know why, but I cannot stick you with your arm shaking. And he was like, oh, I'm sorry. I don't mean to. I'm just a little nervous. And I'm like, it's okay. Understandable. Everybody don't like needles and stuff. But I just need you to try and be calm for like two seconds. It only take me 2 seconds to poke you, and then I just have to get the blood. That just to get that's just a few minutes, and then you'll be good. So try again. This last time he stayed calm. He didn't shake. And I looked at him, so I breathed a sigh of relief because I'm like, phew. Because I'm like, what the world? Because I'm like, this guy had me nervous. Like, I was cool going in. Then you start shaking. Then you got me nervous. Cause I'm like, what is you doing? I'm like, is he having a seizure? Like, what's happening? Like, you got uncontrollable tremors? What's going on? And you talking about you fine? Like, something not right somewhere. So, anyways, I did what I had to do, and then we laughed about it after it was done. Cause I told him, I was like, I'm glad you alright. I said, but you had me worried because I thought you was going to a seizure for a minute. And so we talked and cajoled for a minute. Then I let him go. But I was just like, you know. And then I've noticed over the years, you know, just in general, of having to deal with people and needles, that it be the people with the tattoos a lot of times that have the most problem, and then more more men than women when it comes to the tattoos that have the problem. But still, you got the general people that don't have nothing that have problems with it. But I'm just like, what's going on with these with the people with people with tattoos and needles? I need to understand, cause like I always ask, like, how you don't like needles but you got a bunch of tattoos? And when it's never like a clear answer. So if somebody can finally like break it down to help me understand, that would be great. Cause right now it's still a mystery, but it still tickles me on the inside every time I run across it. All right, well, that's the end of that story. Y'all just comment in the comments. If you are one of those people that have tattoos but don't like needles, please help me understand. And if you just don't like needles, or you don't mind needles, and you have tattoos, maybe tell me what doesn't it bother you about it. All right. Well, thank you for tuning in. Have a good day. Bye.